You check your blood pressure at home. The top number is higher than you expected. You wait a few minutes, measure again, and now the result is different. So which number should you trust? And how high is too high after 60? Many older adults assume that blood pressure is allowed to rise simply because the body is aging. It is true that arteries can become thicker and stiffer over time, but that does not mean every higher reading should be dismissed as normal. Blood pressure also changes throughout the day. It may rise after walking, climbing stairs, drinking coffee, feeling pain, talking, or becoming anxious about the measurement itself. Even sitting incorrectly can change the result. That is why one isolated reading does not tell the whole story. The pattern matters. How you measure matters. And whether the higher number appears with symptoms matters. In this video, you will learn what the two blood pressure numbers mean, why readings can change so quickly, how to measure more accurately at home, and when a high result deserves immediate attention. Because the most useful question is not only, how high was the number? It is, what was happening when you measured it? So, before asking whether a reading is too high, you need to understand what the two numbers are measuring. The top number is called systolic pressure. It shows the pressure inside your arteries when the heart contracts and pushes blood forward. The bottom number is called diastolic pressure. It shows the pressure inside the arteries while the heart relaxes between beats. Both numbers matter, but after 60, the top number often receives more attention because arteries may become less flexible with age. That can make systolic pressure rise, even when the lower number remains closer to normal. For most adults, a reading below 120/80 is considered normal. Consistent readings of 130/80 or higher fall within the high blood pressure range under current U.S. guidelines. But this does not mean that one reading of 130, 140, or even higher automatically tells you what treatment you need. A healthcare professional may also consider your medical history, medications, kidney health, diabetes, risk of heart disease, dizziness, falls, and how well you tolerate treatment. If calm, practical explanations like this help you understand your health after 60, subscribe to Silent Health Triggers. The key word is consistent. A diagnosis is not usually based on one unexpected result taken after rushing, drinking coffee, or feeling anxious. It depends on a pattern of accurate readings and an individual medical evaluation. So do not ignore a repeated high number. But do not panic over one measurement without checking the context either. Now that the two numbers make sense, the next question is whether the measurement itself was accurate. Small mistakes can change a home blood pressure reading. Before measuring, sit quietly for about 5 minutes. Avoid exercise, smoking, and caffeinated drinks for at least 30 minutes. Empty your bladder first. Sit in a chair with your back supported. Keep both feet flat on the floor and your legs uncrossed. Place the cuff on bare skin, not over clothing. Your arms should rest on a table at heart level. And do not talk, watch television, or use your phone while the monitor is running. Cuff size matters too. A cuff that is too small or too large may give an inaccurate result. Use a validated automatic upper arm monitor and confirm that the cuff fits your arm correctly. Take two readings about 1 minute apart. If they are different, record both rather than choosing only the number you prefer. Try to measure at similar times on different days. This gives your healthcare professional a much more useful pattern. A rushed measurement taken after coffee, exercise, or climbing stairs may look alarming, but repeating the same mistakes can also hide a genuine problem. Accurate technique does not guarantee a normal result. It gives you a result you can trust. So what should you do when a number is genuinely high? First, stay calm. Sit quietly for at least 1 minute and take the measurement again using the correct position. A single high reading may be influenced by stress, pain, movement, caffeine, or poor technique. But repeated high readings should not be ignored. If your home readings are consistently 130/80 or higher, record them and discuss the pattern with your healthcare professional. You may need closer monitoring, lifestyle changes, or an adjustment to treatment. Do not take an extra dose of blood pressure medication unless a healthcare professional has specifically instructed you to do so. There is also an important emergency threshold. If the reading is higher than 180/120, wait at least 1 minute and measure again. If the second reading remains that high, but you have no new concerning symptoms, contact a healthcare professional immediately for guidance. But if a reading above 180/120 appears with chest pain, shortness of breath, weakness, numbness, vision changes, back pain, confusion, or difficulty speaking, call emergency services immediately. Do not wait for the number to fall on its own. And do not drive yourself if emergency help is available. The number matters, but the symptoms beside the number may reveal how urgent the situation really is. Once you know the reading is accurate, the next step is asking what may be pushing it higher. One of the biggest hidden factors is sodium. You may use very little salt at the table and still consume too much through bread, canned soup, sauces, frozen meals, deli meat, cheese, and restaurant food. Poor sleep can also affect blood pressure. This is especially important when loud snoring, morning headaches, or daytime sleepiness may suggest sleep apnea. Alcohol, tobacco, low physical activity, ongoing stress, and excess body weight may also contribute. Some medications and over-the-counter products can raise blood pressure too. These may include certain pain relievers, cold medicines, decongestants, and other treatments. That does not mean you should stop anything on your own. It means your complete medication list should be reviewed when readings remain high. Conditions such as diabetes, kidney disease, and thyroid problems may also make blood pressure harder to control. The useful question is not, what single thing caused this? It is, which small factors may be working together? Because pressure that stays high is often influenced by more than one habit, medicine, or health condition. So, once you understand what may be raising your blood pressure, what can actually help lower it? The first step is consistency. Take prescribed medication exactly as directed. Do not skip doses when the reading looks normal. And do not take extra medication after one high result unless your healthcare professional has given you a specific plan. Food choices matter too. A heart-healthy eating pattern usually emphasizes vegetables, fruit, beans, whole grains, lean proteins, and foods that are lower in sodium. The goal is not to remove every enjoyable food. It is to reduce the packaged, processed, and restaurant foods that quietly add large amounts of sodium. Regular movement can also help. Walking, cycling, swimming, and gentle strength training may support blood pressure, circulation, and overall health. The activity should match your mobility and medical condition. Sleep matters. So does treating possible sleep apnea. Reducing alcohol, avoiding tobacco, managing stress, and reaching a healthy weight when needed may also make a meaningful difference. But lifestyle changes do not replace medication when medication is necessary. Many people need both. The most effective plan is usually simple. Measure accurately, record the pattern, take treatment as prescribed, and make practical changes you can continue. Blood pressure control is not about one perfect day. It is about what you repeat over time. High blood pressure deserves attention. But after 60, another question also matters. Can treatment lower the pressure too much for you? A lower reading may be beneficial when it is reached safely and without symptoms. But dizziness, faintness, blurred vision, unusual weakness, confusion, or feeling unsteady when you stand can suggest that the pressure has dropped too low or that it is falling too quickly. This may happen after a medication change, dehydration, illness, a hot shower, a large meal, or standing up suddenly. Older adults can be especially vulnerable because a sudden drop may increase the risk of fainting or falling. If symptoms appear when you stand, sit, or lie down safely. Do not continue walking until the feeling passes. Record the blood pressure reading, the time, the symptoms, and any recent medication changes. Then contact your healthcare professional for guidance. Do not stop blood pressure medication on your own. Your personal treatment plan may depend on your heart and kidney health, diabetes, fall risk, other medications, and how well your body tolerates a lower reading. The goal is not simply to chase the lowest number possible. It is to reach a safer range without causing dizziness, weakness, or loss of stability. So, how high is too high after 60? There is no single number that tells the whole story by itself. A reading may rise temporarily because of movement, pain, stress, caffeine, or incorrect measurement. But repeated readings of 130/80 or higher deserve professional attention. A reading above 180/120 should be repeated after at least 1 minute. If it remains that high, contact a healthcare professional immediately. And if it appears with chest pain, shortness of breath, weakness, numbness, confusion, vision changes, back pain, or difficulty speaking, call emergency services. Do not take extra medication or stop treatment without professional guidance. Instead, measure correctly, record the pattern, notice any symptoms, and bring that information to your healthcare professional. This video is for general educational purposes only. It does not provide a diagnosis and does not replace personalized medical advice, examination, or treatment. Your safest blood pressure plan depends on your overall health, medications, symptoms, and how your body responds to treatment. If this video helped you, subscribe to Silent Health Triggers. Here, we explain the quiet health changes that can affect life after 60 without fear, exaggeration, or miracle promises. And tell us in the comments, do your blood pressure readings change significantly when you repeat the measurement? Your experience may help someone else recognize the importance of measuring correctly. Measure calmly, watch the pattern, and we'll see you in the next video.